Paramedicine is a program that is used throughout the United States where they're using paramedics to help with access of care for patients. So paramedics are now going into homes of patients for non-emergent reasons and assisting with medication, telehealth, helping them keep themselves out of the emergency rooms and out of hospitals by providing care at home.
It kind of goes back to the old days of the doctor making house calls, and especially the older patients, they love that. They remember from when they were little kids having the doctors come to their house and check them out.
She checks my heart rate and blood work and gets my medicine, and her cheery self makes my life more cheerier. Oh, I'm 77 years old. I lived a full life. Went across the country and back several times. Was born and raised here in Spartanburg and Gaffney in Cherokee County. I love to learn. I love to learn something new every day.
I love Miss Hayes. Miss Hayes is a character. She had previously been seen by the heart failure clinic here in person in the past, and I believe she had graduated the program, and she, went a while and was doing well, and she ended up back in the hospital.
Ms. Hayes has what's called preserved ejection fraction heart failure, and what that means is that the left ventricle muscle is stiffened and can't relax well, which leads to fluid retention or congestive heart failure. That causes a patient to be short of breath, have swelling in their legs, swelling in their abdomen, difficulty breathing when they lay down to sleep, difficulty breathing when they do limited or light chores at their house.
I can't really walk very far without my oxygen level going down. They say it's because of my heart.
The Heart Failure Clinic has been in existence for over 20 years. We help patients manage congestive heart failure once they're discharged from the hospital to help manage their symptoms and their medications. Patients that have the diagnosis of heart failure, nationwide, there's a 25% chance that within 30 days of being discharged from the hospital, they are going to be readmitted due to medicines that have not been adjusted based on their body chemistry and their body changes.
Some visits I go out to just take their vital signs, check their weight, make sure they still have all the medicines that they need. I have 5 patients that I'm filling their medication box for them every week. Those visits are just me going out and visiting with them, seeing them, checking up on them. Other visits, we do what we call a telehealth visit, where we do a video visit with the nurse practitioner. Once I get you set up,
we have a tripod that we use with an iPad. It's set in front of the patient. The community paramedic connects through telehealth to our office.
How are you feeling this morning?
In the office, our nurse practitioner is able to hear heart and lung sounds from the patient by a special stethoscope that we use, and also the community paramedic will physically assess the patient, listen to heart and lung sounds, look for swelling, and gives a direct report to the nurse practitioner.
And her abdomen is not swollen. Her heart sounds nice and good.
It's the best thing they've come up with. Invaluable to me. Otherwise, I would have to get some kind of way to get to the clinic. That's an ordeal in itself. It's like just a struggle to get your clothes on, to get on the ride, to get over there. It's an all-day thing.
We can already tell that our patients are getting better care by me going to their house, and they're not getting those readmissions to the hospital from not getting the follow-up due to being unable to come into the office or getting the transport to the office visits that they need.
We are giving these patients a better quality of life with very close follow-up with these patients, especially after hospital discharge. Our goal is to have telehealth within 7 days of discharge. So telehealth assists with access to care because these patients, they don't have cars, or they can't drive, or they can't get themselves in and out of a car with their walker, their oxygen.
Technology it's gone so far, I'm telling you. It's amazing. some of the things that they're able to come up with just makes your life more easier.
I really think telehealth will continue to grow. I think there's been a widespread acceptance of the viability of this type of care. I believe that it gives you continuity and flexibility of care without sacrificing the quality of care.
These patients that we are seeing in the home, they are grateful. The caretakers are so grateful because they're not having to take time off of work. It's helping in their lives too. It not only affects the patient, it affects, as I say, the village that helps care for this patient.
Here, let me touch this part. I said the other day, I feel like I've collected 34 grandmas and grandpas that I need to check on all the time. But I've got 34 friends, and I worry about them, and you know, I want to make sure they're taking their medicines like they're supposed to. And even if they push back on me a little bit and they've been doing it a certain way for years, I'm like, well, maybe you can feel a little better if I help you fill your med tray, and we make sure we're definitely taking them the right way.
She's part of my extended family now. Well, I'm going to adopt her.